Welcome to everyone who is joining us. We're just waiting another 30 seconds, 60 seconds to let more people come in, but we will be getting started soon. Okay, welcome everyone. I think we're going to make a start because we do have a packed agenda. Thank you so much for joining us today. I am Carolyn Houseman. I am Vice Chair of the Alliance Steering Committee. I'm also CEO of a charity called Children and Families Across Borders. To commemorate the 10th anniversary of the Alliance, we've been showcasing some of the achievements as well as some of the challenges that we faced in strengthening the social service workforce. And today we're going to discuss some of the findings from the Alliance's recently released 2023 State of the Social Service Workforce Report, which has also followed this theme. Through a moderated discussion, we'll then examine two scenarios that the social service workforce must be positioned to respond to over the next decade, that being climate change and an aging population. And of course, central to this is being clear about what a well-equipped social service workforce looks like. So as we get going, feel free to use the chat feature at the bottom of your screen to introduce yourself. If you aren't doing so already, go ahead and put your name, maybe what country you're joining from. That would be really helpful. Now, this webinar has been designed by and is being hosted by the Global Social Service Workforce Alliance. The Alliance is an open network of members working to strengthen the social service workforce so that we are better able to address the needs of at-risk individuals and communities. We have more than 3,500 individual members across 150 countries. Registration is free, incredibly, and open to anyone committed to or interested in strengthening the social service workforce. You can find more information about the Alliance at the website, which is www.socialserviceworkforce.org, and I'm sure we can put that in the chat for you as well. So just a few logistics before we get started. We do not have live translation for this event. However, closed captioning is available in multiple languages, and you can find that by going to the Show Captions button on your screen. Please submit questions for any of our speakers at any time during the Q&A button, through the Q&A button. It's really helpful if you've got something that pops into your mind, just go ahead and put it in through the Q&A button. And if you're having technical difficulties, please send a message to the host through the chat button. The webinar is being recorded and will be made available on the Alliance's website. So if you have colleagues that want to take a look afterwards, go ahead and point them to the Alliance's website. So just very quickly, here's an overview of what we're going to cover today. First, we're going to have Hugh Salmon, who is the director of the Global Social Service Workforce Alliance, set the stage with a brief overview of the 2023 State of the Social Service Workforce Report. Then we will have moderated chats with two experts in the areas of the social service workforce as they relate to climate change and aging populations. Rebecca Smith, who's head of child protection programs at Save the Children International, will moderate these conversations. And we'll be joined by Lisa Reyes Mason, interim dean and associate professor at the University of Denver's Graduate School of Social Work, and she'll discuss the role of the social service workforce in climate change. We'll also have Shireen Hussain, professor of health and social care policy at the London School of Hygiene and Tropical Medicine, and she'll discuss the role of the social service workforce in navigating aging populations. I'll now turn over to Hugh Salmon, Director of the Alliance, to provide an overview of this year's State of the Social Service Workforce Report. Thank you.
Thank you so much, Carolyn, for that great introduction, and great to be with you all today. It's a wonderful opportunity that we have to launch this report. So I'll just be going through a few slides, just make sure that my computer advances those properly. So this report was actually prepared last year to mark our 10th anniversary as an alliance, and we're launching it right now officially through this webinar, and we will have a chance, obviously, to discuss it with our panelists. The report had two particular objectives. One was to look back over what was achieved since we were officially launched in 2013, but actually since 2010, when there was a conference that really was the starting point for our work, but also to look forward. And that's why we have the discussion later on about the future trends that we might need to be looking at and thinking how, as a global social service workforce and alliance, but also with yourself as our members and other partners, how we can all react and adjust and be ready for these trends. So just briefly, those of you who are not aware, every year, almost every year since we started, we've tried to release a State of the Social Service Workforce report. So you can see quite a few of them there. And it's not a complete compendium of everything that we know about the social service workforce in that year, but it's thematic. So it's trying to find a particular focus that is relevant for that particular year. So as you can see, at the time of the pandemic, we focused on COVID-19 and the response and adaptation. We've also looked more recently at humanitarian contexts. But the most recent one, because it was marking that 10 years since we officially launched in 2013, we really tried to look back over that period, as I was just mentioning. So we called it a decade of progress, a decade of promise. And those of you who were with us in our Social Service Workforce Week event in October, we also discussed some of the findings there, and we had a discussion about what are the main trends that we have learned. And it's not just our work as an alliance, but it's also what you've been doing that may not necessarily have been directly with us, but others have been working on social service workforce. And we really wanted to try and learn overall from the sector of the progress that's been achieved. So just to give you a little bit of background about ourselves and the history. So 2010 was that landmark conference in Cape Town, which we was called, at that time, it was the Social Welfare Workforce Strengthening, but ever since we've been referring specifically to the social service workforce. And that was when teams from 18 different countries came together to address this crisis of, particularly at that point, we were really focused on child protection needs. But of course, we, as an alliance, we exist for the workforce that meets the needs of all different members of the population. At that time, there was this crisis identified of child protection needs, but the social service workforce for that was under-resourced, particularly trying to look at the gaps where there were not enough professional social workers and how to bridge the gap between the professional social work and the community-based social workers who may not have a professional qualification, but are parasocial workers, community volunteers, and others. So that was a key event which marked the launch of a global movement. And the idea of a global alliance like ours was born to really create dialogue for effective sort of workforce strengthening practices. And so we were officially launched. It took a few years to get all the pieces together, but we were officially launched in 2013. My colleague Amy Bess was the first director, and there was a steering committee. And some of you here today, I'm sure, were steering committee members at the time or members and may well have been with us with all that time. So thank you so much for sticking with us. Many of you will have joined since then, and our alliance has been growing every year since then. So the purpose of this particular report was to look at those 10 years and examine how things have evolved, but also to look at the key, both achievements and challenges, and as I've mentioned, future priorities. We do all this within the context of the social service workforce strengthening framework that we developed way back. I think the first version of this was actually conceived at that conference in 2010 in Cape Town, and it's been worked on with our partners, particularly in UNICEF and in the US government and others, to come up with a sort of global consensus on what are the main elements that need to be worked on to achieve wider social service workforce strengthening. And in this diagram, anybody who's been to one of our webinars before will probably be familiar with this diagram, so I won't dwell on it, but it really, you can see how it encapsulates the pillars: the planning, which is so important so that we can have a strategic approach, having human resources to the right number in the right places. We recruit those people, strengthen them, and build alliances across all stakeholders. And then as we're working right now at the moment with communities of practice in 5 different regions, we're also specifically focused on things like ratios of the workforce and then costing of the workforce to make sure that there is enough and they are sufficiently resourced. That comes under planning. Developing is really about the education and the training for the workforce and strengthening their practice. And then supporting is really considering the difficult working conditions that they have, the stresses that they face, how we can support them also through different tools, resources, and crucially with supervision. Supervision of each worker needs to have a proper qualified supervisor for their work to reflect on the most difficult cases, but also professional associations. And many of you today, I'm sure, represent national professional associations of social workers, or even associations of other specialists within the social service workforce. They all have a key role to play in advocating for and supporting the workforce in your respective country. So that's the overall scheme, but each country, it needs to be adapted to that context of the specific country in which this approach is being applied. So this report, it was carried out through key informant interviews, focus group discussions, which were held online with experts in multiple different countries, and then an in-depth literature review. We analyzed the themes that were coming out of that with the help of our consultant and the experts in that group. And then we did a kind of triangulation to look at the data, what we were learning from those different sources, and come up with the common themes. But we'd recognized there were certain limitations. We only could conduct a certain number of interviews. So apologies to those that we should have really interviewed that we didn't get a chance to. And of course, a lot of the published literature, even today, still remains, unfortunately, too much in English and too much Western-centric. So that is a limitation, I'm afraid, in many such of these desk-based reviews. But we went further and we had multiple conversations. And we actually focused in on 3 particular countries where we feel, not to say these countries are, absolutely the most impressive countries worldwide, but they are countries that stand out in their region for having been countries where a lot of change has happened in this area and a lot of lessons have been learned. So we looked at Romania in the context of the Europe and also Eastern Europe, Central Eastern Europe region. We wanted to find one standout country, Uganda in the Eastern African context and Vietnam in the East Asia Pacific context. So just looking briefly at some key highlights, which you can very much find in the report at much greater length, but just to show that Romania came out of that tradition of communist rule and a time when social work was actually banned. So it had to really build up almost from zero in 1989. And planning involved legislation, creating a framework for social work, and really importantly, getting local public administrations to think together how they would provide those social work services which had been missing for so long, primarily to keep families together and to strengthen the family and the children and other vulnerable individuals in the context of the community, rather than previously, as had many countries in that region, and particularly Romania, had been relying on large residential institutions. Developing, so what we talk about developing when we talk about the training and education of the workforce, and that was very much achieved through improving the quality and reach of university training and also professional regulation of how that training is provided, the education and the way people are licensed and registered as professional social workers in Romania. Crucially then, to support the workforce, the National College of Social Workers of Romania had a very important role to play and adopted a professional code for the workforce, and also there was a key point there with all the stakeholders in coming together to clarify the career ladders for social workers, and that led to initiatives to boost the visibility and recognition of the profession across the different parts of Romania. But there are still challenges of recruitment of social workers, particularly in the most remote and rural areas. It's hard to achieve the coverage, but great progress has been made. And a little quote here from Diana from the National College of Social Workers saying that professional code sets the standards, the methods, the techniques, and training. It really defines what it means to be a social worker in Romania. So that was a turning point. Looking at Uganda, also there is the background of the colonial impact, that the missionary efforts, they also shaped the way that social work was initially conceived And so there was a rather initially sort of Anglo-centric or Eurocentric approach, but actually there's a much longer tradition of the African concept of Ubuntu, which is very strong in Uganda. And I think that just encapsulates the fact that there were pre-existing traditions that were very strong prior to colonization, which then had to be really synthesized and taken into account in developing a national model of social work. So since independence, there have been decades of progress in this area to really develop a Ugandan approach to social work. And in terms of planning, that has involved all the key stakeholders in a planning process. And most recently, we have been privileged to be part of this, actually, developing national frameworks for the social service workforce, but also for social care and support. So what that means is a framework for the services, and how they're provided, and also a framework for the workforce and how that should be strengthened. These are important policy frameworks with plans and roadmaps to go with them. Other efforts have included indigenizing the social service workforce, and a notable achievement there was the most local level having 11,000 parasocial workers trained over 5 years. Still not, unfortunately, in every district, but many districts in Uganda now have those parasocial workers that can complement the social welfare officers who are more likely fully qualified social workers at the district level. So you can see how different levels of professional social work in the district, community or parasocial workers at the most local level, those have been developed over time. And then the National Association of Social Workers in Uganda, our colleagues from that association have always been very active, and maybe with us today, has had a very prominent role in supporting its members throughout that time and advocating for the profession and promoting its resources. Vietnam also has that influence of colonialism, in this case, French colonialism, but it also has its own national traditions and culture. And again, the challenge was to try and come up with a Vietnamese model for social work with that kind of a legacy. So the first legal recognition was in 2010, and then they had a 10-year strategy to implement social work, which is a good commitment to develop over a reasonable period of time. And now they've adopted another 10-year strategy to go even further. And that has involved expanded training, increasing the quality of the training and education programs, and overall improving the curriculum for social work. And in supporting the workforce, there have been partnerships that have helped increase the number of paid social work positions. And now there are social workers working also in schools and health settings in the local communities, and increased, crucially, field placement opportunities so that students can not just attend classes to learn social work, but they can actually have a supported, supervised internship opportunity in the field to learn about social work before they qualify, which is so crucial in every country. And the quote here from the Director General in the Ministry of Labour, Invalids and Social Affairs says that many localities have taken proactive and determined actions to implement social work development programs. So as a result, they're seeing that there are many, many more people now who can access and benefit from social work services. So just very briefly, some global trends overall, we see that there is increased acknowledgement of the workforce, that it's the diversity of the workforce, as I mentioned at the beginning, that it very much includes professional social workers, but also paraprofessionals and community volunteers and at different specialities. There's been an increase in the adoption of national strategies and laws, and that has led to the formalization of the workforce. And you can see that in 2022, 65 countries had some kind of a normative framework which defines roles, functions, and procedures for social work and social services. So that's really great progress that we've seen. Other developments have been in the area of curriculum and crucially about indigenous knowledge, like I mentioned, trying to make sure that we're not importing models and knowledge from outside, but there's also that key contribution from indigenous that may go back many centuries of traditions of knowledge that are about social work and work in the community. Professional associations having a key role to play, as I already mentioned, and then making sure that there is collaboration and coordination across all the relevant sectors. But some key challenges: social service workforce is often still misunderstood. People tend to think that they know much more about the health workforce and the education workforce because everybody remembers having a teacher or a doctor in their life. Up to the level of ministers, they know what is needed perhaps to plan and cost the workforce in those sectors, but there's much more vagueness and lack of certainty as to what a social worker looks like, what's a social service workforce, and how it needs to be strengthened. So funding as a result of that lack of awareness is often not there, or it's not there for long enough, or it's not clear enough, or it doesn't cover all the things that are needed. So there may be salaries, but there may not be an adequate. There may, as a result, be high turnover. There may not be enough supervision, enough training. There may be no ability to travel to do home visits. So that means that we need more evidence for what impact the social service workforce can make in order to demonstrate its unique value and have sufficient investment. So looking ahead, our priorities, working with yourselves, will be to increase the clarity on the composition of the workforce. And I talked about the ratios, the different roles and how many we need and in what roles across the workforce, to showcase its value, to build investment and provide further tangible support for the workforce, and then develop a plan that particularly takes into account and further promotes the inclusion of Indigenous knowledge. So you can see we've got a 5-point plan that we really need to work together on for the next 10 years. And we call upon all of you to help us to build that support, investment, budget allocations to get a much stronger workforce going forward. That's all a whistle-stop tour of the report. Please go into it in more detail. You can find it on our website. And I'll now hand back to my colleagues because we're going to move forward with the rest of the presentation today. Thank you.
Thanks so much, Hugh. That was so interesting and so heartening to hear about the founding aims of the Alliance and the role that the Alliance has had in strengthening social service workforce over the last decade, and particularly to have that in-depth view of Vietnam, Uganda, and Romania. But now I'm going to hand over to my colleague Rebecca Smith at Save the Children International to moderate a discussion on the two key themes of today, which is climate change and an aging population. Over to you, Rebecca.
Wonderful. Thank you, Carolyn. I'm really excited because, as you know, the world as we know it is constantly changing, and we need to make sure that the social welfare workforce is responding to that. And that we're well positioned to respond. Today, we'll be speaking about two relevant areas around climate change and aging populations. And I'm really excited to share with you our fantastic speakers today. We'll be starting the conversation with Lisa Reyes-Mason, the Interim Dean, Associate Professor of the Graduate School of Social Work at the University of Denver. And she's going to be discussing the social service workforce and climate change. So we'll start first with a question. Can you tell us a little bit about your background and how you got interested in the field of social work as it relates to climate change?
Hi, Rebecca. Glad to be here. Yes, absolutely. So I received my MSW over 20 years ago. So in 2003, and in social and economic development. So in the US, so much of social work is more clinical, often providing therapy. I, by contrast, was always more of a macro social worker, although I joke that as interim dean now, I use these clinical skills all the time, every day, but that's another story, another webinar. So as a macro social worker at the time, I was interested in addressing poverty, community development, and policy change. And I had been practicing in that space for about 5 years when I decided to go back for my PhD in 2008. And that's when I shifted my work to this nexus of social work and climate change. So about 15 years ago. But the seeds of that interest were planted much earlier for me. So I'm Filipina American, and I was delighted to see in the chat some colleagues on here joining from the Philippines. I grew up with my mom telling stories of growing up in the Philippines in Quezon City and the time that her uncle rescued her in the street from the rising waters of this catastrophic 50-year flood, is what she would always call it. And as I was growing up and staying connected to news back home, I realized that these 50-year floods were happening more and more often, and likely due to climate change. And so my own personal background kind of led to some of this professional shift to working at the nexus of social work and climate change. Social work and the work of the social service workforce is, in my view, fundamentally really a profession about social justice and about helping people thrive. And so I realized that climate change wasn't just this environmental issue, it was this critical social justice issue in the Philippines and other countries where I had lived and worked. And then, of course, in my own home in the US. And so that's how how and when I shifted my work to climate change and climate justice.
Oh, wonderful. Really interesting. Thank you.
Mhm.
What do you see as your role of the social service workforce in helping individuals and communities build resilience and adapt to the effects of climate change?
Yes, so social service workforce is just essential in this work. Climate change, sometimes we talk about it, and I find it helpful to talk about it as a threat multiplier to what's already precarious access to basic human needs in so many places. There's already inequitable access to food, water, clean air, in many places, increasingly even social connection. And so climate change is a threat multiplier to access to these and to equitable access to them. So one way that I like to talk about this is, for everybody here today on the webinar, maybe you have a particular focus of your work. So maybe you focus on care for children, or you address food insecurity, or maybe you work with older adults. I encourage you to take a moment, think about, jot down now or after the webinar, how does climate change threaten the well-being of the people you already work with, whether you have been working on climate and environmental justice or not? What are those overlap points? What are those intersections? How can you connect the dots between what you already know so well, because the social service workforce is like on the ground, partners with people, knows the lived experiences of people. What are those intersections then with how climate change is worsening access, and then what can we do about it? So I want to use aging as just one example, since it connects to the next part of today's event. Again, the social service workforce is often engaged in very close participatory engagement with communities. And so what might community assessment look like directly with older adults who are impacted by climate change? Through that community assessment, the workforce can find out what the particular needs are of older adults, and also what strengths do they bring for resilience and for adaptation solutions. So we know that in many communities and cultures, our elders are venerated for their knowledge, their wisdom, their life experience. So are there, in some contexts, practices related to food storage, food security during drought that our elders can still teach us? Or maybe during times of, extreme weather crisis or disaster, is it our elders who have the most connections in community and know best who needs to be checked on, who needs to be cared for, who needs some extra support? And so tapping into that elder wisdom and knowledge as a resource for adaptation. Another example I'd love to give is this idea again of the social service workforce being on the ground, having that expertise, and using it to challenge the official narrative at times in order to raise awareness about a problem. So as a concrete example here, I think back to my work on water insecurity. It's been this many years since I was back in the Philippines, but about 10, 12 years ago now, when I was doing my dissertation work in Baguio City in the Philippines. And at the time, Bawadi, the Baguio Water District, would say with pride that 80% of households had access to piped water in their home. Well, people who know Bawadi, in case there's anybody on the call today, Bawadi stands for, again, the acronym is Baguio Water District, but people would joke that it meant Baguio Walang Danom, which means Baguio has no water. Because what the general statistic masked was, first, the 20% who didn't have that piped access into their home. And then second, the reality on the ground that water was piped only a few days a week for a few hours at a time. And so you had great inequities, right, in who could store water. And so families that could afford large storage tanks were much better off in coping with water insecurity than families that maybe at best just had one single drum in which to store water. And again, I think it's the social service workforce who knows these lived experiences, knows the realities, and can again sometimes work to document the problem and use that to challenge the sometimes official narrative.
Wonderful, great examples. Could you share examples of successful interventions or programs? I think you sort of touched on this already, but looking at that, fostering sustainable and climate resilient communities.
Mm-hmm. Yes, absolutely. So here in our MSW program, we created a few years ago a new concentration in ecological justice specifically. And we have a growing number of students now who are trained to provide therapy or direct practice services that are truly climate informed. And so we have clinicians now, social workers who are aware of and can respond to climate grief, to eco-anxiety, and of course to disaster-related PTSD in their practice. So there's that, like, the importance of that climate-informed approach to clinical work and therapy, especially in a context like the US where so many social workers are trained to do that kind of work. Another example is when social workers have engaged in local disaster planning efforts. And sometimes their titles in these positions aren't social worker, but they're using their social work skills to, get other jobs with city agencies or departments that are working on community development or disaster planning. And so social workers, again, drawing on that community wisdom to work with communities to develop their own neighborhood-based disaster plans. So that when extreme weather is approaching, communities are ready with their informal care networks to check on each other, pooling resources for recovery, and then also sharing knowledge on how to navigate what are often complex and unfair bureaucracies that provide formal relief. And so sharing the knowledge of how to navigate access to those systems is something that I think social workers everywhere are trained to do to kind of navigate these complex systems. I'd love to give an example or two on the mitigation side also, the importance too of social workers being engaged in working to reduce greenhouse gas emissions, the human-induced gas emissions that are causing climate change. So we have another alumni of ours who went on to organize against extractive mining practices in the US Southwest, and since then has joined a statewide citizen utility board in another state to advance equitable access to clean energy. And then a team and I published in 2022 a scoping review looking globally, the best we could find with our scoping review method of social work engagement in mitigation. And some of the examples there ranged from social workers writing or being involved, writing about or being involved in like energy at home initiatives, which are often tied to some other aspect of human sustenance. So for example, we have a social work colleague who works on clean cook stoves in India. And so a great example of addressing both climate mitigation and indoor air pollution and the health of women and girls in particular. And then I when Hugh was giving his opening remarks, I thought of another example to share, which is Hugh mentioned that many members here today and in the network are also part, perhaps, of their of social work associations back home, in their own countries or contexts. And so that's a place too where we've seen, like some countries have put environmental justice or something about the natural environment in their codes of ethics. And that's a way to kind of reach and encourage broader social work engagement in this issue. In the US, in our MSW, like in our social work education competencies, we also, our National Association for that, CSWE, has also put after much advocacy by many folks over many years, put environmental justice into the competencies for the first time. So that's another way that is concrete that folks can advocate in their countries to broaden the reach of knowledge and then skill about this nexus of social work and climate change.
Wonderful, great. And for any of you on the line, do write your questions and we can share them as well. What do you consider the key priorities in strengthening the social service workforce so they can address social challenges posed by climate change?
Yes, so in thinking about this question, I thought I would answer it in the form of more like 3 key strategies or takeaways, I think, for addressing these challenges for folks today. The first goes back to something I said earlier about connecting the dots across issues. I emphasize this a lot in talking with people, finding allies and collaborators in that way. Climate change is a thread and a threat that really connects all these issues. It runs through all of them that the social service workforce is already engaged in. Second, know that you don't have to be an environmental or climate expert to do this work. In fact, what we really need are more and more people who know the human impacts and are directly engaged with and connected with people and community in order to plan for and implement these care and coping strategies that we need. And then third, keep growing the network. I loved learning about the size of this network, the connections. So keep growing that network within countries, regions, and across this amazing global network. Because while the contexts and therefore implementation strategies might differ, there's so much of this collective knowledge and experience that can be shared. We are all facing this threat, experiencing it already. It's not just a threat, it's already here. And we can share ideas, share resources. What did work in your community? Maybe that sparks an idea for me in my community. And honestly, I think that in all the work we do, and then climate change being another layer on top of it, that connection, I think, serves as this foundation of hope also for our own resilience and persistence in continuing to do this work in what is a rapidly warming world.
No, thank you. Lots to think about. And I love your thinking about connecting the micro and sort of the individual case management to that macro social justice. How do we really make sure that the people that are most affected are actually, that their experiences are being recognized? And really interesting. I'm going to pass over now. Please do write your comments or your questions. This is trying to be more interactive. I know it can be kind of intimidating, so please don't worry. Any question is welcome. I'm going to pass over now. We're going to be speaking with Shireen Hussain, who's the Professor of Health and Social Care Policy at the London School of Hygiene and Tropical Medicine, and she's going to be talking about the social service workforce and aging populations. So welcome, Shireen. We're really excited to have you today. Can you tell us a little bit of your background and how you got interested in the field of social work as it relates to aging populations? Thanks.
Yeah, thank you, Rebecca, and hello, everyone. So I'm a demographer and a statistician by training, and perhaps the first decade of my life, I was working on kind of population issues that are specific to health outcomes for mothers and children, and then looking at the dynamics of family formation and decision making. And after that, it was serendipity that made me come across the kind of social services in general and the interplay between health and social care, what we call it, or social services. And aging has been always kind of coming up through the demographics. We kind of, think about always mortality and fertility, and then life expectancy comes here. And my work, has been predominantly in UK and Europe, and this is a huge and big issue. And I've been working on social services workforce, particularly for many years. However, in the last decade or so, I've also become interested in the global population aging and how that might differ from when we talk about OECD countries or European countries. Not only the pace of aging, but also perceptions and preparedness. And in 2020, I have founded a network called the Minara Network, which focused on aging in the Middle East, and also kind of exchanging. So it's a platform for knowledge exchange and thinking about the various components when it comes to aging. So there is so much happening here, whether it's healthy aging, whether it's increased needs, and the role of social services is really pivotal here in the many dimensions that comes with aging and intergenerational exchange.
Thank you. Very interesting. Now, given the number of people age 65 or older is projected to more than double by 2050, what do you see as the role of the social service workforce in helping communities and families adapt to aging populations?
Right. So obviously, the role of social services worker is pivotal, but it's really important to think about the fact that aging society in itself does not necessarily translate linearly to a linear increase in individual requiring social care. However, it's the dynamics of needs that evolves, that influence it with different factors like changing health paradigms, lifestyle trends, and also the inequalities that are experienced across the globe within communities and across communities and cities, and also the levels of preparedness to aging, whether it's at the individual level or at the societal level, the perception. So we see, for example, in low and middle income countries, because the society has been young for a long period of time, the understanding of the needs of older people and the perception that where the society can offer to older people and older population is maybe different, but also there are very good cultural practices that we can capitalize in. Hence, the social services workforce has to be proactive in their approach and have to approach these needs in a way that is tailored to the communities and the diversity within communities. So, we know that aging, mobility or migration, and of course, climate change are three of the mega trends. So we always live in diverse societies with diverse needs. And with the increased needs, so the increased needs comes, unfortunately, we live long. Fortunately, we live longer, but unfortunately, we don't live all these years in health. So there is a gap that is not closed yet between what we call healthy life expectancy and life expectancy. And this gap creates a place for needs. You have multimorbidity, you have the coexistence of multiple chronic conditions, and also the changing demographics and the family structure. So people, even if they have children, they might not be living near each other as before. Obviously, there has been a huge decline in fertility. The norms have changed, the availability of informal carers. So there is a need for more formal interventions, and that come across a huge spectrum from engagement to awareness to assessment of need to the provision of the care itself, but also in coordinating across different sectors. So we live in very complex systems, and the relationship between social services and health and education and employment becomes really important. And social service workers have to navigate this and include proactively the individuals within this equation.
Thank you. What do you think are some of the key challenges the social service workforces are thinking about in dealing with these aging populations, with the challenges and the quality of care?
Yeah, I think I touched it on the first challenge, which is these complex systems that we live in. So it's often that it's not that one person or one individual will need just social services or just health or just education services. There is a huge importance to realize the connectivity between everything. And that comes from concepts like, person-centered care. So you have the individual in the middle, and you have coordinated care. So there needs to be some systems in place to facilitate this coordination. Unfortunately, and Hugh touched upon that, the social service workforce suffers from quite a few challenges. One of them is the unequal status across different systems. So people recognize the importance of healthcare workers. They don't really realize the importance of social service workers, because not everybody comes in touch or have the experience of social services early on in their lives. Also, the trends in the changes of how care is delivered and how care is commissioned are organized place some systematic and structural challenges to social service workers. The casualization of work. So there is a trend of marketization. There are good trends around, care in place and personalization and tailoring services, but that translates in many times into marketization and having care as a market and having care as a commodity. And that impact on how care is organized, how workers are perceived, the working conditions, the pay, the status, etc. So really, there is a need for policy to establish a kind of a framework to prioritize how to improve the working conditions of social services workers, to improve their status, with the realization that their work will impact on the lives of older people. The other big challenge is that we see in research that there is limited collective agency for this workforce, and they're working with vulnerable groups who themselves have limited agency and limited power. So I think it goes hand in hand to combat kind of ageism and also improve the status of social services worker and maintain systems and policies and approaches that improve this kind of interaction, but also the status of the workers, seeing them as valuable in maintaining the quality of life of older people, but also the whole society. The older population is a very significant proportion of the society, and they play a very active role. You're muted, Rebecca.
Oh, sorry. Can you just talk about the demographic changes that intersect with climate change and how you see this impacting the social service workforce? And
I think it's really interesting hearing, Lisa, and I think it has been traditionally that people thought about climate change as a mega trend separate from aging population, but they interact hugely, and they can't be looked at in isolation. So we have to realize that older people as a group is very diverse and have varying vulnerability and can be disproportionately affected impacted by climate change. However, there are some considerable combination of physiological factors, housing, and socioeconomic conditions that make older people more vulnerable to climate change and changes in, like heat waves, kind of extreme cold. So from a physiological perspective, older people tend to have challenges. So we're talking about the very old who need care. They tend to have challenges in regulating their body temperature, for example. So that's a very simple fact that they will be more affected. They might be less mobile. They might have pre-existing conditions such as heart disease, dementia, that they can get really upset and stressed with these situations. And also housing condition, we have to think about where people live. And that becomes important in low and middle income countries. So we know that there is a huge reliance, say in agriculture, and there is a huge number of older people in rural communities. And having land affected by climate change could have a huge impact. So I really liked what Lisa said as a kind of the climate is a multiplier effect. So you have to think of older people in terms of they are kind of a heterogeneous group. Not all of them will be impacted the same, but there are factors that lead them to be a priority. but also to recognize that they're not bystanders and they have their own agencies and they have their own kind of traditions, and thinking of to kind of mitigate some problems. But one thing also need to realize at the structural level is ageism. So ageism in society might not prioritize older people. So if you are in a situation of crisis and you have to prioritize responses, sometimes older people are not prioritized. And this needs to be tackled. And I'm very pleased that within the decade of healthy aging, this is promoted as a key factor to combat ageism. And social services workers here have to play a pivotal role in promoting and advocating and proactively kind of respond to the needs of older people. So I would say being, having a preventative approach and understanding of where people live, whether their housing conditions are suitable, if there are heat waves. We're seeing a lot of heat waves and extreme conditions that are happening more often than before. So it's really about being having awareness and knowledge of the conditions of older people and how they respond, and being kind of thinking about preventative rather than responsive. And that happens also in humanitarian crisis. So we often see older people left behind and not prioritized. So having that awareness and also having the right resources and training, they could respond in a better way.
And really thinking about that prevention element before just thinking about the response. Great. Exactly. We had a really interesting question from Adis in Ethiopia, and he's asking about how you, or she is asking how to contextualize this. Is it a narrative around sort of a context, an overarching context, or are we looking at climate change and aging as risks that are then amplifying risks, I suppose? And Lisa has already responded that she thinks it's both.
Yeah, I think it's the interaction between the both. It is not like separated. So we're living with megatrends that are happening, and we have to realize that climate incidents, as they call it, whether it's increased heat wave or flooding or whatever, will happen more often. And then we have communities of older people that are vulnerable. And for example, simple things like being prepared or taking action. So we need to really older people themselves to be more empowered to say, well, I have the right to take action and to look at my housing conditions and have a plan if something happened, what to do. So it goes two ways, and it's one of the elements that are very important to keep in mind. Ideally, we all want to live in better health and being more prepared to the any climate crisis that happens, but realizing that also things like financial security and ability to have the fund to move and mobility, just basic, kind of ability to access, if you want to evacuate, or how long do you need before that? So having awareness of all these issues and being prepared, and as you said, it just being proactive, having a plan in place, checking on people, making sure that they could be evacuated or checked upon, because not to rely that they will call if there is they might actually feel bitter cold or scorching heat until they have other conditions, because different symptoms or conditions that they have.
Interesting. And can you share some examples of successful programs or interventions by the social service workforce that really positively impacted the well-being or independence of aging populations?
Yeah, I think it's really important to start by remembering that there is a trend in changing the thinking about older people. So it's about person-centered care, about independence, about empowering people, rather than just serving them or having them in a nursing home. So that's really good to remember this approach. And a lot of there are a huge number of interventions that happening to create these communities and to empower individuals and go beyond just a medical model that we are responding to your personal care needs, or that is due to your health conditions. I'll mention a few things. So in the UK, for example, there is something called Silver Line, which is initiated by workers, by social service worker, where they actually connect with older people. So it's like a helpline, but it's a two-way helpline. And they talk to the older person to find companionship and to improve the social inclusion of the individual in the community. And there is huge evidence that when you have better social connections and you are more participated and engaged, that your health outcomes are better, and actually you rely less on the formal care. For example, one good example from Japan, and they are really leading the way in creating these age-friendly cities, and they have holistic approach to prevent falls. So that is actually social service workers take a role of advisors and advocates for older people's safety. They do home assessment and identifying potential fall hazards, and they have a plan to mitigate this or reduce the risk. And also they collaborate with different agencies, the local authorities and community members to implement these changes. So they have this plan, but they go to make sure that they have implemented things like handrails or lightening. So it's really creating an environment where older individuals can move around with confidence and safely. So that's in Japan, and I'll give examples from India. So we're seeing a lot of community-based care, primarily initiated by NGOs that are also proactive and having these senior citizens clubs, and they within the clubs, the social service worker will organize regular checkups, and it's almost like a soft assessment of needs, but it comes within a social context that you're coming to do something nice with your friends. They do things like health education, emotional support. So it's a really hub. These clubs, serve as hubs for interactions. And other things, span things like digital and technology awareness. So in Canada, there is something called Cyber Seniors, which is like the social service workers become tech coaches. So they organize and lead workshops that is specifically to improve digital literacy and to get older people understand more about the digital landscape. And they provide like tailored training, and that is really, again, to empower individuals and give them confidence and ability to live independently. So you can see a range of interventions that is diverse and tailored to different needs, that goes beyond the traditional model of just providing personal care or assisting with medication. These issues will remain very important, but this is where the tasks and role of social service workers have expanded and included so many new elements and skills and trainings.
Wonderful, thank you. I have one more question for both of you, if can get Lisa back up, but just in terms of the impact of not investing in the social service workforce, especially with aging populations and climate change, if you could both think about, what is the impact in this lack of investment?
Yeah, I can start. The lack of investment is huge, because we see in many places that the funding is not huge, and that has impact on both the workers who remain as workers. They have huge workload, and their well-being is impacted, but also in the ability to meet the needs of individuals and their families. And we could see that the informal care burden will be huge. We will see, and there are loads of studies around the cost of this when it comes to shifting from receiving your care at home or in the community to being forced to be in a hospital, which is much, much more expensive. Or, of course, the human cost of loneliness and depression and stress. So there is a huge cost for the society, for everyone. And we've seen in the informal care side that people leave employment to care for their parents if there is no sufficient and adequate workforce. So there is an economic cost as well associated with informal carers.
Thank you. I echo Shireen's comments so much. I was typing some responses to the other questions that relate to this, I think, so I won't be able to get them there. But what I was going to say was, related to this issue of the burnout then of the social service workforce. The social service workforce in many places is so underpaid, under-recognized. And so so if there isn't that social service workforce, then the impacts are even worse, as Shireen has said. And also, I think that what gets lost is then where are the voices, and especially around justice and equity. I worry about that impact there getting lost.
Wonderful. I think you've both given us a lot to think about today, and especially I know with Save the Children, we often focus on, you know, the direct case management or individual issues, and we really do need to think about that social justice angle and how do we point out populations that are more at risk, or, you know, why they're more at risk, and really trying to hold governments or others to account for things that we do need to take on more of an advocacy lens to. Really, really interesting. So thank you both today. Over to you, Carolyn.
Thank you, Rebecca. You know, hugely impressed by what's been talked about today, and I think there's a lot I would love to comment on, but I know that we're just 1 minute over. So really, all that is left for me to say for those who have remained on the call is to give you a reminder, please, to download the State of the Social Service Workforce Report 2023. It's on the Alliance website, and a link was posted in the chat. Please be sure to join the Alliance. It's free, it's wonderful, and you can stay connected and stay informed about future events. And then finally, a thank you to our host, you know, Hugh and Elena for organizing everything, to Rebecca, Shireen, and Lisa. You've all have been absolutely wonderful. And to everybody who's attended today, when you close out of this event, you should see a very short survey pop up with just 3 questions. So please just take a note of that and don't close out too quickly or forget that it's there. Fill out the survey and let us know how we can improve future events, as well as letting us know what future event topics you would like to hear about. So without any further ado, thank you again, and see you all soon.